So now we're going to look at the diagnostic tests that we look at with blood work. Of course, we have the CBC, which is the complete blood count. We'll talk briefly about PT, PTT, and INR. You always look at your hemoglobin. Coombs testing, both direct and indirect, is done during blood typing. And those are the parts of that I would want you to know. Okay. Basically just know that what your CBC is and what are the parts of it for this slide. Now on the next slide, not so much. When we're looking at our diagnostic testing, when we're measuring for bleeding and coagulation times, these are the labs that we look at. Okay, and again, if you open up your presenter's view, you'll see my notes, so you don't have to try to stop me to write it all down. Your PT or your prothrombin time, excuse me, is used less often now to see how fast blood clots. They now use the INR, which is the International Normalization Ratio. A normal INR is between 0.8 to 1.1. When it's used to monitor warfarin, which is an anticoagulant, the desire is usually between 2.0 and 3.0. Now, the exact number, of course, is depending on the patient, but do know that when an INR is used for to monitor for warfarin therapy, which is an anticoagulant, you want to see a desire of 2.0 to 3.0. The PTT, which is the partial prolactin time, assesses the intrinsic clotting cascade and is prolonged when one of the factors is in deficit. It can be prolonged with liver disease. And so let's think, if we have a longer clotting time, what does that mean? We're going to bleed more freely. Okay, when we bleed more freely is when you see, which you also see a lot with liver disease. Okay, now listen to me. This is the anti-factor 10A. In the hospital, you'll hear it called anti-10A. Do not call it XA. People will make fun of you. I'm kidding. People really won't. Yeah, they will. Okay. Again, it is anti-factor 10A. That is the Roman numeral X, which is 10. Okay? All right. I'll get off my soapbox. So anyway, anti-factor 10A is used to monitor heparin therapy. And the standard heparin is 0.5 to 1 international units. Now that standard heparin, like for like when you're seeing a heparin drip, low molecular weight heparin, like your Lovenox injections, is 0.3 and 0.7. Okay, they also will give factor when you have someone who is bleeding, they'll give them factor 10A to help with their that clotting. Okay, they'll give the 10A, not the anti. All right. Platelet aggregation is the ability for platelets to clot, and it can be impaired with von Willebrand disease. It used to be a syndrome, and use of a lot of NSAIDs or aspirin, some psychotropic drugs or agents, and platelet inhibitors. Okay, and remember your platelet inhibitors are like your Plavix. I'm so sorry, I'm not very good with my generic names. They're medications that help the platelet be more flexible so that it doesn't form clots, okay? So that's where your platelet aggregations come in. On this slide, PT, PTT, INR, the anti-factor 10A, and the platelet aggregation is what you would need to be aware of. So moving on, sometimes they will use standard X-rays or radioisotopic testing to look at different, they use it for the spleen and the liver to look for enlargement or damage to the spleen. So these are times that you will see imaging studies done. Okay. excuse me, one second. Bone marrow aspiration is done in order to test the bone marrow. It can be used to identify the presence of a leukemia or other malignancies, or to determine the cause of the anemia. When you're helping with a bone marrow aspiration, you want to make sure that you're prepping the patient, trying to decrease anxiety. They're usually just laying over on their side. The book says you really only need one nurse. I think that if you're dealing with anyone of any age, you may want a second nurse so you can have someone who's actually facing the patient to be there to kind of just be supportive. Follow-up care, the nursing priority, oh, look, I capitalized, is to prevent bleeding and infection. These patients do not need to take any type of aspirin, and you can use ice packs and mild analgesics for pain after the procedure, okay? But look, the nursing priority would be to prevent bleeding and infection after a bone marrow aspiration. And so that is all you need to know about Chapter 39.